I just want to apologize to everyone again for my IT issues. My video, for whatever reason, wasn't restarting. So it's now 11:10. We were supposed to restart at 11, but that's entirely my fault. So I apologize. So this is the hearing in docket number 26-32835-CON. It's the CON application filed by Johnson Memorial Hospital, and it concerns the proposed termination of outpatient cardiac and pulmonary rehabilitation services at Johnson. So we left off with a question regarding the last page of the Exhibit O, which was the response to the hearing issues, or the second to last page, rather. So the thing that I think would be helpful for us to know is whether Johnson can provide the CBT or DRG code for the services that are billed to insurers. Is that right, Annie, Steve?
Along with the costs then associated with those codes.
Okay.
Yes.
The cost, can I clarify that the
Yes.
costs associated with those codes?
Yes.
Okay.
And then it's for all of those 3 hospitals, again, for those years that we were looking for.
Okay. And one last question before we turn to public comment. So earlier we were talking a little bit about in-home rehab as opposed to on-site rehab. What is your understanding as to where those conversations stand internally with respect to engaging the services of a third party for in-home rehab services?
We had the first meeting. Well, actually, the only meeting we did recently, do some outreach to them just to try to get an understanding of their ability to help accommodate any patients that may be in need. So we are open to helping, assuming Dr. Roos is in agreement with this, but we are open to helping navigate the at-home services if that's something that we can do locally here. I mentioned the organization is local to Connecticut and does do work currently in this region. So I think it is an option.
Yeah. So I think there's a strong likelihood we will continue to have conversations such that we establish some collaborative memorandum around referring patients. I don't expect that it's going to be a service that we are going to, assume or manage or,
Yeah,
have
I'm not
any
asking you to
contractual relationship to
starting
it,
a new
yeah.
service.
Yeah,
Yeah.
but in terms of establishing a more formal referral relationship, I think that there is a likelihood that is an offering that we will continue to pursue.
Okay. Thank you, Dr. Roos.
Yep.
So Steve, Annie, Andrea, do you have any other questions you wanted asked? No? Okay.
No, I think we're all set. Thank you.
So we are going to turn to public comment. Very quickly, we haven't had anyone sign up for public comment, so we are now going to turn to late files. I have in my notes that there are 4 late files. And I will follow this hearing with a written order. So to the extent that anything is, I want to have a conversation so that we're all on the same wavelength and understanding when we leave this conversation, and then I'll memorialize that in writing afterwards. So the first of the 4 late files that I have is the percentage distribution of patients between those who are using the VAO service, Lyft service, or transporting themselves to rehab.
Mm-hmm.
And I believe that was specific to Johnson Memorial and didn't extend to St. Francis or St. Mary's. Any questions on that one? Okay. The second one was regarding the tables on page 5 of the issue responses. We wanted clarification around the visit numbers and the encounters and how those align with the 2-year period. It was noted that those numbers appear to diverge from some of the other utilization figures that we have, and we're just trying to gain an understanding as to whether there is a divergence or in what way that those relate to one another. Number 3 is information regarding patient compliance with treatment protocols pre and post September 2025. So you could provide like a year or two prior to 2020, probably 2 years prior to 2025, and then from 2025 forward, to the extent that that information can be acquired. Any questions on that one?
Nope.
Okay. And the last one is the CPT and DRG codes and the costs associated with each for all 3 hospitals for the identified fiscal years in response to issue number 6. That was fiscal year 2023 through 2028. Any questions on that one? Okay. So normally, Attorney Anthony, we will take like a 5-minute break, and you can discuss with your witnesses how long you think you might need in order to get those late files to us. Typically, it's about 2 weeks. Do you guys have any understanding as to how long it might take to pull this together, or do you want to talk off the record?
What do you think, Patrick?
Seems 2 weeks reasonable.
2 weeks, yeah.
I think 2 weeks is reasonable. Yes.
Okay. If you do need more time, just let us know and we can extend that a little bit.
Okay. Thank you.
Anything else, Attorney Anthony, that you wanted to discuss before I open it up to closing remarks?
No, nothing else. Thank you.
Okay. Did you or any of your witnesses want to make any closing remarks? You don't have to.
No, I don't think so. I just, I guess on behalf of, the applicant, I would just want to thank you and the entire staff. We very much appreciate the opportunity to, help with the questions and, respectfully request that you approve our application.
Okay, thank you. So thank you to everyone who attended today. Reminder again that written public comment can be submitted up to 7 days from now at comment@ct.gov. That's CON as in certificate of need, comment@ct.gov. So this hearing is hereby adjourned, but the record will remain open until closed by OHS after receipt and review of the late files. Again, I will be issuing an order probably sometime later today that just memorializes those 4 late files that we discussed. Thank you very much, and I appreciate you're all attending. Have a
Thank
good
you.
day.
Thank you very much.
you.
Thank you.
Bye-bye.